If your period pain dictates when you work, how you sleep, or whether you can show up for people you care about, this matters. That level of disruption isn't something to shrug off. One possible reason is endometriosis, often called endo. Endometriosis isn't just bad cramps. It's when tissue similar to the lining of the uterus grows where it shouldn't, outside the uterus. That tissue still responds to monthly hormones, which means swelling, inflammation, and pain in places that were never meant to handle it. That's why endo symptoms can feel bigger than your period and spill into everyday life. Pain is usually the first thing people notice, and not the kind you fix with a couple of ibuprofen and a brave face. We're talking pain that makes you cancel plans, miss work, or lie awake at night staring at the ceiling. Pain that can start days before your period and linger after it ends. If over-the-counter pain meds barely help, that's important information. Another common sign is pelvic pain outside your period. Random aches, sharp stabs, a constant heavy pressure that shows up when you're not bleeding at all. That's not typical cycle discomfort. That's your body telling you something's off. Endo also loves to mess with digestion. Many people deal with intense bloating that makes their abdomen feel tight and painful by the end of the day. Not "I ate too much pizza" bloating, more like uncomfortable swelling that hurts to move or sit. Add constipation, diarrhea, nausea, or pain during bowel movements, especially around your period, and it starts to look familiar. A lot of people get told it's IBS, try a bunch of diets, and still don't feel better. That overlap is common with endo. Then there's pain during or after sex. This one gets minimized a lot, but it matters. Pain with penetration or deep pain afterward can make intimacy stressful instead of enjoyable. It can affect confidence, relationships, and how you feel about your body. This isn't something you're supposed to just tolerate. It's one of the most common endo symptoms people keep quiet about. Fatigue is another big piece, not the "I stayed up too late" kind, more like bone-deep exhaustion that doesn't match how much you did that day. You rested, you slept, and you still feel wiped. Chronic inflammation takes energy, and endo creates a lot of it. That constant drain adds up. Some people also notice lower back pain, hip pain, or pain that radiates down the legs. Endo can irritate nearby nerves, which explains why symptoms don't stay neatly in the pelvis. If you've ever thought, "Why does my period pain feel like a full-body event?" you're not alone. Here's a frustrating truth. Symptoms don't always show up clearly on scans. You can have severe pain and still get told imaging looks normal. Endo doesn't always appear on ultrasounds or MRIs. That's one reason diagnosis can take years. During those years, many people hear the same lines over and over. "Periods hurt. You're just sensitive. Try stress management." Meanwhile, life keeps getting interrupted every month. If your period pain affects your ability to work consistently, sleep through the night, exercise, or feel present in relationships, that's not a small issue. That's a quality of life issue. Quick pause. If this sounds uncomfortably familiar, consider saving this. Not to panic, to keep track of patterns. When pain eases, it's easy to forget how bad it gets, and then the cycle repeats next month. Endo symptoms can also change over time. Some people start with painful periods and later notice pain outside their cycle. Others develop digestive issues or fatigue years after the pain began. That progression is common and confusing, which is why many people feel like they're constantly chasing explanations. This isn't about self-diagnosing from one video. It's about recognizing a pattern that deserves a proper evaluation, ideally with a provider who understands endometriosis and takes pain seriously. Being persistent isn't being dramatic, it's advocating for your health. Another thing that often gets overlooked is the emotional toll. Chronic pain changes how your nervous system functions. It can affect mood, focus, sleep, and stress tolerance. Feeling anxious or low when you're in pain all the time isn't a personal weakness. It's a normal response to ongoing physical stress. If you're thinking, "Why does this explain my life a little too well?" that reaction is common. Many people feel relief just hearing their experience described accurately for the first time. Here's a simple check-in question. Does your period pain force you to plan your life around it? If the answer is yes, drop a comment, even a short one. Someone scrolling might finally realize they're not imagining things. If you know someone who's experiencing this, share this video with them. Sometimes validation is the first step towards getting real help. And if you want more straight-talk health explanations that connect the dots without the fluff, like and subscribe.